Hello, my name is Brittany King, and I'm going to talk to you about my experience on the DASH diet.
You may be wondering what the DASH diet entails. DASH stands for Dietary Approaches to Stop Hypertension, and the goal of this diet is to reduce blood pressure. The guidelines are 7 to 12 servings of fruits and vegetables per day, 6 to 11 servings of grains, half of which should be whole, 2 to 3 servings of non-fat or low-fat dairy daily, 6 or fewer servings of lean meat, poultry, or fish daily, 2 to 3 servings of fats and oils. It is suggested that trans fat be completely avoided and that saturated fat is very limited. 3 to 5 servings of nuts, seeds, and legumes weekly, and 5 or less servings of sweets and added sugars per week. The rationale behind this diet is that increasing fiber and nutrients such as potassium, calcium, and magnesium through increasing fruits and vegetables and whole grains helps to decrease blood pressure. This diet also limits trans fats, saturated fats, and added sugars, which are associated with high blood pressures when eaten in excess.
Most of the evidence that I looked at regarding DASH diet's ability to decrease blood pressure was done in the late 90s. And most of the research done today on the DASH diet is concerned about the diet's effects on diabetes and weight loss. But here are 3 studies that I found that were related to the DASH diet and lowering blood pressure. One study involved 495 participants, and it compared 3 diets and their ability to reduce blood pressure. The diet included a controlled diet that resembled a typical American diet, which was low in fruits and vegetables and high in fat, a high fruit and vegetable diet that maintained all other aspects of the control diet, and the DASH diet. Participants were randomly assigned to the diets. All meals were provided for 8 weeks, and sodium intake and weight were controlled throughout the trial. Participants were over the age of 22 with an average blood pressure of 131.3 over 84.7 millimeters mercury, and it was untreated by medication. The DASH diet decreased systolic blood pressure by 5.5 millimeters mercury more than the controlled diet, and diastolic blood pressure was decreased by 3 millimeters mercury more than the controlled diet. The p-value was less than 0.001. Another study that sought to assess the DASH diet's impact on blood pressure was a randomized controlled trial including 144 participants who were overweight or obese with hypertension. Participants were assigned to one of 3 diets: their usual diet, the DASH diet, or the DASH diet with a weight loss program. At the end of 4 months, the DASH diet was shown to reduce blood pressure by 11.2 over 7.5 millimeters mercury. The p-value was less than 0.001. However, greater reductions in blood pressure were seen in the DASH diet along with a weight management program. This p-value was also less than 0.001. The DASH diet, accompanied by a weight loss program, decreased blood pressure by 16.1 over 9.9 millimeters mercury. Further research has been conducted on how patients with type 2 diabetes respond to the DASH diet. 31 participants with type 2 diabetes completed a randomized crossover trial that placed them in the control diet or the DASH diet. The control diet had a macronutrient distribution of 50 to 60% carbohydrate, 15 to 20% protein, less than 30% fat, and less than 5% simple sugars. Participants followed the assigned diet for 8 weeks with a 4-week break in between. After adhering to the DASH diet, systolic blood pressure decreased by 13.6 millimeters mercury, plus or minus 3.5, compared to a 3.1 decrease, plus or minus 2.7, with the control diet. The p-value was 0.02. The DASH diet resulted in a 9.5 millimeter mercury decrease in diastolic blood pressure in comparison with the control diet, which only decreased diastolic blood pressure by 0.7. P-value for this was 0.04. The DASH diet also decreased weight, waist circumference, fasting blood glucose, A1C, and LDL cholesterol in participants and increased HDL cholesterol.
First couple of days on the DASH diet were a little difficult. I had trouble balancing my meals at first, light lunches but heavy dinners, and sometimes I like to eat like that, but other times I just cannot eat that much at dinner, and that was definitely, I had trouble adhering to what I had planned in advance for dinner. Sometimes I just couldn't eat that much. Also struggled getting enough iron and calcium while I was planning my diet. But I realized that the iron problem was because I wasn't focusing enough on adding beans and lentils or other protein sources. I was just focused on trying to get all the fruits, vegetables, and whole grain servings in that I could. And then the calcium was because I lowered my dairy and cheese, and I don't think I had any cheese. So adding a cup of milk here and there definitely helped, but I struggled for a little bit with that one. Planning and prepping meals was very time consuming for me. I'm not used to doing all three of my meals. I'm very lucky in the fact that my boyfriend will usually cook for me, and at work I eat the meals that they give out. So definitely time consuming. After a couple of days, it was way easy to reach my goals. I established a pattern. I didn't have to thoroughly plan anything. I just kind of knew an eyeball estimation of servings. I started finding out foods that I really liked combining, I consistently enjoyed together. I also found some recipes that I really enjoyed. And then also I did notice after about 3 days, my energy levels definitely improved. So that was a bonus I did not expect. I found the DASH diet to be extremely flexible, and I was able to meet all of my DRIs while on it. A couple of tips and tricks that helped me adhere to the diet was keeping dried fruit on hand. This helped me with my sweet tooth, which was pretty bad for the first couple of days since I completely kicked out desserts. The next thing would be keeping some canned beans and dried lentils around. This is a quick, easy, tasty way to add some protein to your diet without the added saturated fats. And a huge lifesaver was frozen vegetables and fruit. Frozen vegetables, the prep was already done. I just threw them in a steam basket along with my rice in my rice cooker, and I had a quick meal ready to go. Frozen fruit, just threw in yogurt, super easy, very handy. Lastly, I have some recommendations for you to help you guide individuals who may be interested in starting the DASH diet. First, I highly recommend slowly working up to suggested servings within the guidelines, especially if they're not used to eating a ton of fruits and vegetables. Maybe starting with one meal at a time, and also if they're not used to a ton of fiber in their diet, may have some gastric upset that could discourage an individual from continuing the diet. Educate on the difference between saturated fat and unsaturated fats. This is very important since the diet limits saturated fats mainly. Show what a serving of specific food groups look like. Some people may not know what a serving of grains or a serving of fruit look like. So this is important to provide some visuals. Introduce the client to different types of protein sources that are low in saturated fat. Teach the client how to look for added sugars and packaged goods. Give examples of meals to order when at a restaurant. This is very important in maintaining the social aspect of meals and food. And also provide DASH-friendly recipes. I know once I started looking up recipes, this helped me. There are tons of really yummy recipes out there, and there are entire cookbooks dedicated to this diet.